Hi, everybody. My name is Tricia Taylor Lightbout, and I'm a journalist turned epidemiologist. And today we're going to talk about pandemic planning for small businesses. I'm a proud alumni of the Masters in Public Health program at the Northwest Ohio Consortium for Public Health, which is a joint program between University of Toledo and Bowling Green State University. And I'm also an alumni of the College of Business and Innovation MBA program. I'm proud to partner with University of Toledo for this webinar to bring this planning for small businesses out to the public. We're going to talk about how this planning program came about. I'm going to introduce myself, tell you a little bit about my background. We're going to walk through some checklists and how you can assess your business for the potential impact of any pandemic, whether it's coronavirus, COVID-19, or whether it's a pandemic, influenza, or any other disease. It doesn't really matter what the disease is. The important thing is that you plan appropriately for long-term closures. So here's a link to my LinkedIn profile. I am born and raised in West Toledo. I've lived all over the country. I came back to Ohio to pursue a master's in public health at the Northwest Ohio Consortium for Public Health. And in that program, in the summer of 2007, in our public health finance class, we looked at the potential economic impact of pandemic flu on Wood County. It was a joint project where we partnered with the health commissioner from Wood County, who was a graduate of our program, and I led 15 graduate students through the project and was the editor-in-chief of the final paper. So in that project, we looked at impact for large businesses, small businesses, what it meant for tax revenue, how it would impact workforce planning for first responders. We looked at logistics and food care or food service, every sector of the economy. And then when we were done with the project, I took that project and the model that we used, and I did smaller projects as a result, including the impact of pandemic flu on families living in poverty. I also looked at the impact of a pandemic flu on dialysis centers and home healthcare centers, and also for small businesses. I've taken that small business planning model, dusted it off, and upgraded it for today's situation. And I can tell you that when we look at pandemic flu models for planning, and we look at how we should plan for coronavirus 19 or COVID-19, the principles are the same. We should still plan for 1 to 12 weeks of impact at the height of the pandemic. And we should plan, in terms of small business, that the most significant impact for small businesses will occur when daycares and schools close to contain the spread of infection. So what we're going to do is we're going to walk through how do we start getting ready for when daycares or schools close. First of all, what's the difference between an epidemic and a pandemic? An epidemic is a sudden but temporary increased prevalence of an infectious disease that impacts a specific geographically defined area or community. A pandemic is an epidemic that spreads globally on more than 2 continents with sustained human-to-human transmission, typically a new or emerging infectious disease. We are, in fact, in the middle of a global pandemic for coronavirus 19, COVID-19. So large organizations have teams that are dedicated to pandemic and disaster planning and response, but small organizations like your company, if you have less than 100 employees, you have limited resources. You don't have an HR person, you don't have a pandemic response team, so this plan is for you. Large organizations like University of Toledo, Bowling Green State University, ProMedica, Mercy Health, large counties, the state of Ohio, Ford, GM, Dana, they all have people dedicated to this kind of plan, but you probably don't have the resources because you're a small business. So what I want you to do right now is take a deep breath, don't panic, and let's start to plan. The first thing you want to do is stay informed with reliable sources regarding the current status of the pandemic. I've included some links to the World Health Organization, the CDC, the Ohio Department of Health, and Lucas and Wood County. If you're joining the webinar from other areas, I would encourage you to track down the appropriate website from your local health department so that you can monitor what's happening in your community. And I would also advise you to critically evaluate any information you see on social media. There's a lot of people on Facebook or Twitter that think they're experts and they're really not. If you go to the World Health Organization, the CDC coronavirus COVID-19 website, ODH, or your county health department, they're going to give you the most relevant information. I'd also advise you to check the websites for local school districts daily to monitor their status. Figure out where the kids of your employees go to school and figure out how they're going to communicate any school closures or any impacts. So on your daily checklist, go through all of the public health organization stuff, check your local school districts to see what's going on there, and monitor local news and news organizations that you trust. And remember, always think critically about the information that's on social media. So what do you do next? Think about your business. What do? Are you an independent artist that sells stuff on Etsy or eBay and you rely heavily on UPS or FedEx? Are you a plumber? Are you a dog groomer? Are you a bakery? Do you own a small restaurant or coffee shop? Do you have a metal shop that supplies stuff to a second or third tier auto supplier? Think about and make a list of all the goods and services you provide to your customers. Then think about, how will the pandemic affect the demand for your particular goods and services? If you own a coffee shop or a bakery, are you going to sell more or less of your donuts? If you are a home health agency, are you going to have a higher demand or lower demand for your services? And if the demand for your business increases or decreases, will you have the staff, inventory, and resources available to meet the demands of your business? And think about, what are goods and services that you normally provide that will be essential for your customers during a pandemic? And are there other businesses with which you could partner to provide essential goods and services in the event of a pandemic? If you are a cleaning supply company and you are functioning at limited capacity, can you partner with one of your competitors that's also functioning at limited capacity so that you can provide essential services to first responders or healthcare organizations? Those are the kind of things that you want to think about today. Next step, think about your workforce. How many part-time and full-time employees do you have today? Can your employees work from home? If you have a small neighborhood insurance company and everybody has a laptop and access to the internet, your employees can work from home. But if you own a bakery, you can't really bake cookies or donuts from home. If you own a restaurant, you can't really serve food from home. Or if you're a plumber or an electrician, people have to show up in person. So think about, can your employees work from home or can they not? And are your employees cross-trained for essential functions? So if you own a small coffee shop or a bakery or a restaurant and none of your waitresses show up or your serving staff, does that mean you can pull somebody from the kitchen? And likewise, if you have absentee in the kitchen, can someone from the service staff step back on the line and cook? What about if you're an electrician or a plumber, or you do HVAC contracting? Can all of your employees do all of the jobs, or do you need to cross-train them today? Think about that. You probably have an absentee or sick time policy for your part-time and full-time employees. So if they miss more than 3 days of work without a medical excuse, they might get some kind of HR punishment. But you might have to adjust that in terms of the pandemic. If schools are closed for 30 to 60 days, how will you adjust your current absentee or sick time policy? In Japan, schools have been shut down for a month, and they'll likely be shut down for at least another month. In Wuhan, China, people were not allowed to leave their house for between 30 and 45 days. So look at your current absentee sick time policy and your policy for paid time off and think about how you might need to adjust those things. Another consideration is, are your employees available if your hours change during a pandemic? If you're running at limited hours or extended hours, how many of your employees will be available? Another consideration is how many of your employees have children in childcare or grade school, and where are all of the daycares and school districts that serve your employees? Because if the school shut down, daycare shut down, they have nowhere to send their kids. If they're a certain age, they might not be able to show up for work. Another consideration that is specific to COVID-19 is the elderly population is particularly at risk, and people with underlying issues or pre-existing conditions. People are at risk if they have compromised immune systems. So another question for your employees, are they caring for an elderly parent or grandparent? Are there people in their family it might be necessary for them to provide support to if they have an underlying issue, if they have COPD, if they have asthma, congestive heart failure? So besides the schools being closed, you also want to think about who in your employee population might be caring for sick or elderly folks. And the other thing to consider is you might have an employee that doesn't have any kids, doesn't have elderly parents, and that employee could get sick. So think about all of those things in your workforce checklist. Are you prepared for people not being able to show up for work, either because they're sick or because they're caring for somebody who is sick, or because they don't have any daycare options? And then think about, how are you going to pay your folks? Do you have policy where they receive full or partial wages if they're missing work for a sick family member? Do the people that you work for you, are they going to be significantly financially impacted? If they're part-time employees, they don't get paid if they don't show up. If they can't show up, what's that going to do to their ability to pay rent or pay for food or transportation? Think about that. What is the potential impact to your employee population, especially if you have part-time employees? And also think about which employees have significant others, partners, or spouses that are involved in healthcare, public health, emergency response, and would be working overtime during the height of a pandemic. So, for example, if you have an employee whose spouse is a nurse, the nurse might be working overtime or extended hours to care for people who are sick. Or if you have an employee whose spouse or partner is a first responder, first responders will be working overtime when it hits our community. Think about that when you look at your workforce and who's going to be available. Who they're married to or partnered with has an impact on their ability to come to work. And when you think about your plan, how and when will you communicate any pandemic-specific policies or changes to your employees? You should start talking to them today. And think about if you decide to close, if you decide to work different hours, if you're changing your policies, you have to keep your employees informed. So next, let's talk about the customers that you serve. Who are your customers? Do you serve the general public, the people who come in to buy your donuts or coffee or come into your restaurant or your bar? Or do you service business to business? Do you provide supplies or construction materials to other businesses? Or is it a mix? Do you have people walking into your donut shop every day, but you also have restaurants that you deliver donuts to on a regular basis? Who are your customers? What goods and services do they use? And then rank them all according to their use of your goods and services by overall business, meaning who are the customers that spend the most money with you, and by category. And think about who will have increased or decreased use of your goods and services in the midst of a pandemic. Is there an opportunity to increase your customer base in the height of a pandemic because your competitors are either closed down or functioning at a limited capacity? Is there an opportunity for you when you look at your customers? think about if you have a business to business model for your small company, are any of your customers going to close down or function at a limited capacity? Are any of your customers potentially going to, are you going to lose them short term or long term? And which customers will you be able to serve, and which customers will you be unable to serve if you're functioning at a limited capacity? When you think about overall, how much money do they spend? What are some essential things during a pandemic that your customers might need? You're going to have to rank and prioritize them, right? So how and when are you going to communicate with your customers before, during, and after a pandemic? And there are variables that are specific to your business. Let's talk about vendors and your supply chain. Make a list of all of your vendors and suppliers. And by all of your vendors and suppliers, I want you to include your internet service provider and your public utilities, water, heat, electric, anything that you need to function today. Who are your vendors and suppliers? And then ask your vendors and suppliers if they have a pandemic response plan, and establish a communication plan and timeline for the people and services and goods in your supply chain. Are your vendors going to have service delivery limitations? If the Postal Service or UPS or FedEx or any of the delivery services that you have limited hours because they have the same absentee rate of employees that you do, are you going to be able to get what you need to stay open or to deliver your goods and services? Have those conversations with your transportation and logistics vendors today. Will your needs as a customer be a priority for your vendor? If Amazon, UPS, the post office, if they determine that they're only going to be delivering to high priority customers during the height of a pandemic, serving first responder and healthcare related needs, where do you fall in that line of priority, and what does that do for your business? Are there other vendors that you can turn to if your vendor is unable or unwilling to provide goods and services, especially in terms of logistics? If you normally use FedEx, is there somebody else you can turn to? If you normally use the post office, will you switch to UPS? Or, think about if another vendor shuts down, is there another vendor that you can go to? And think about that today so that you're not in a panic when the time comes. Another thing to consider is, are there vendors who you will not need in the height of a pandemic? Think about your supply chain. If you think that in the height of a pandemic, when schools are shut down and we're at the height of, the most people being sick in our community, are you planning on only servicing 25% of your customers? Does that mean that there are some services you're not going to provide, and you should contact your vendors and supply chain and let them know that that's going to be an impact so that they can plan for it? And always think about, are there vendors whose goods and services will be essential during the height of a pandemic? Where do you fall in their priority? And what are the variables that affect your needs for your specific businesses? Let's talk about your inventory. Assess your inventory today and think about your inventory needs before, during, and after a pandemic. What will you need more of? What will you need less of? Does your inventory have a shelf life? Is it perishable? Does it have an expiration date? If you work in the food industry, if you have a bakery, coffee shop, restaurant, is there stuff that's going to spoil that you're going to have to get rid of? Do you have a regular delivery of milk or cheese or meat or vegetables that you're going to have to cancel to make sure that you aren't throwing stuff away? Or maybe if you're a construction contractor or an HVAC company, electrician, a plumber, your shelf life, you don't really have a shelf life, you don't have perishable inventory. But you might have other things that you need to consider, right? Do you have a disposal plan for lost inventory if your inventory is perishable or has a shelf life or expiration date? And does your insurance cover lost inventory specifically as a result of a pandemic? It probably does not. It would probably cover a flood, a fire, some kind of weather-related event, or an act of terrorism, or some kind of man-made disaster. But you should have a conversation specifically with your insurance company about your policy. What would it cover as a result of a pandemic, especially in terms of inventory? And how will you address inventory shortages? When you think about your vendors and your suppliers, if you continue to work, if you're a construction contractor or you're an HVAC provider, and you still have to fix things, plumbers and electricians, people will still have plumbing and electrical issues, especially in the healthcare sector. And if you can't get the right inventory to meet those needs, how are you going to address that? All things to think about. You should have a plan ahead of time. And let's talk about the bottom line. What are your fixed costs? What are your variable costs? When you look at, after you do all of these checklists, what's the impact to payroll? How will it impact your benefits? If you have a part-time employer or a part-time employee who receives healthcare benefits because he or she works 25 hours a week, and in order to be eligible for benefits, they have to work consistently 25 hours a week, and your business is shut down for 6 weeks, will your part-time employee lose his or her benefits? Think about that today. What's the impact of payroll? Will you still pay them if your business is shut down? Will you still pay them if they're part-time employees, but they can't come into work? And what's the impact to your employees if they're not receiving wages, because they don't receive wages if they don't walk in the door and do their job? How's that going to impact your employees? If they're already living paycheck to paycheck, how are they going to make rent, make their car payment, pay for gas, pay for food? Think about that. Is there potential to lose customers short or long term? Is there potential for employee turnover? Are you going to lose vendors or suppliers short or long term? All of that feeds your bottom line. All of these checklists lead to, what do the numbers tell me? And one of the most important things to think about is, do you have enough capital or credit on hand to meet your obligations, your costs and debts short term if there's no revenue or a decrease in revenue? Or will the changes in revenue during the height of a pandemic impact your ability to meet short-term and long-term obligations? Do you have capital? Do you have credit? What are your bills going to look like? You still have to keep the lights on. If you're brick and mortar, then you still have to pay for electricity and your utilities, right? You still have to pay for your website. You still have to pay for your internet service. Are you going to be able to do that if your revenue goes down, short or long term? And then, is it better to close or operate at a limited level during the height of a pandemic? And remember, like we said at the beginning, you want to plan for 1 to 12 weeks of impact. Because at this point, we don't know how long schools might be shut down, or how long, or the impact to the community, because the infection rate is changing as the virus impact evolves in the population, right? That's why it's important to keep connected with the WHO and the CDC and your local health department and the state health department, so that you understand what it looks like. Monitor what's happening in other communities and plan for 1 to 12 weeks of impact, so that you're not surprised if schools are shut down for 6 weeks, that doesn't take you by surprise. So then the biggest question, people ask me this all the time, how do I know when to close? Well, that's up to you. The toolkit that we've just gone through can't answer that question for you. It can help you lead to the right question. I can't guarantee you any outcomes. I can't guarantee you that you're not going to lose money. I can't guarantee you that you're not going to have staff turnover. I can't guarantee that you're not going to lose customers. But if you use the toolkit, it will help you answer the right questions, gather the right data, and come to your own conclusions. So, thank you for joining me for this webinar today. I appreciate the folks at University of Toledo who've invited me to host the webinar so that we could get information out as quickly as we could to small businesses. We will be working with other organizations to help distribute this material. If you want to share it with other small business owners in your network and in your circle, or with your vendors and suppliers or your employees, that's fine, as long as you give me, Tricia Taylor Lipout, appropriate credit and don't try to pass this information off as your own research or your own study. We will be organizing some conference calls and some more WebExes, so after you look at this, you'll be able to call in and ask questions so that we can help walk you through. We're also going to be working on developing some other materials specifically for small businesses. We're going to be partnering with some economic development folks in the community and also with the local Chamber of Commerce. And I am available if you want to get on the phone with me or send me an email. I can help you with questions. I'm not charging any consulting fees. I'm not asking for any compensation. I do not want to get paid for this work. I want to make sure that you pay attention to what's going on so that you can do what is best for your business. Thanks very much. I appreciate your time. And remember, don't panic, plan, and for Pete's sake, wash your hands. Thanks, everybody. Have a great day.